Um, I'm very pleased to be here this evening to speak with a Democratic Party grassroots group. I want you to know I'm an elected delegate to the Democratic Party convention from the 41st Assembly District. So pleasure to be here with a sister organization. But I'm not here today as a delegate of the Democratic Party, and I do have to correct one thing in Mike's very generous introduction of me. I am not a current advisor to the president. I was an advisor to the president's campaign. But I do work on these issues a lot, and I want to share with you some perspective and information about not just Barack Obama's healthcare reform proposal, but the one that is emerging as a general consensus in the Congress among Democratic leaders in the Congress as well. Now, I was going to talk a lot about the problems that we face, but my colleagues here, Drs. Baldwin, Dario, and Hendrickson, and Robert Reich, and Dr. Schroeder's excellent video, have all done a magnificent job of doing that. So I don't need to reiterate what they said, but I do want to point out that the situation with the uninsured has gotten so bad that the greeting card industry has had to create a whole new line of cards that are designed just for the uninsured population, because the ones that everybody else gets just don't cut it anymore. So we have a problem of 46 million Americans without insurance, 25 million Americans with insurance that doesn't cover expected high costs of medical care if they get very sick. We have a system that is out of control in terms of the growth in healthcare costs in all the ways that were already described, putting strains on families, on businesses, on government. It is the biggest single source of the growth in our deficit in the United States, the rising expenditures that we must make for Medicare. So we have to bring this system under control. But in addition, whoops, sorry. That's fine, thank you. We have very poor quality indicators also pointed out by my colleagues. So I'm not going to dwell on these. But what I do want to point out is that we had a campaign, a presidential campaign, in which all three key Democratic candidates basically had the same proposal. And Barack Obama was elected president, and his proposal is the one that he ran on and was very prominent in the campaign. These were not side issues. He got a huge mandate from the voters, and he also has, and the Democratic Party has, a significant majority in both houses of Congress. These are keys to success in getting healthcare reform enacted at last. We have been at this for 90 years in the United States, and it is time we were successful in getting a universal health insurance program or coverage enacted. But there are some obstacles to this. And one of those, I think, was pointed out by Dr. Hendrickson. I think he actually underestimated the amount of money that the pharmaceutical industry has been spending on lobbying on healthcare reform just this year in Washington. It is my understanding that they have been together, pharma and their member companies alone, and this is not counting the insurance industry, but pharma and its member companies have been spending an average of $3 million a day in lobbying the Congress, hiring just about every lobbying firm in Washington and their own armies of lobbyists, communicating their perspectives and their interests in the process. You can imagine that the insurance industry and other profitable industries in healthcare have been doing very similar kinds of good grassroots lobbying work with resources that overwhelm and completely dwarf the kind of effort that those of us who are advocates of progressive reforms, like those discussed earlier, can actually achieve and put in the field in Washington. But we do have strong leadership in the House on this issue. We have good leadership in the Senate, and we have very good leadership in the White House. We need to mobilize support for what they are doing, because they are our best hope of getting health care reform. What is it that they're proposing to do? Well, in the House, we have 3 House committees that have jurisdiction over health care reform. House Energy and Commerce Committee, House Ways and Means Committee, and the House Education, Labor, and Pensions Committee. That committee, those 3 committees joined together and developed a single health care reform proposal. That's a huge step forward compared to 16 years ago when President Clinton's own reforms were being countered by members of his own party in the House, and there was very little unity about the proposals being put forth. I'm going to speak mostly about that bill, but that bill has been voted on by 2 of those 3 committees. I think it's important to understand that the 3rd committee in that, chaired by our own Henry Waxman, has not been able to vote out that bill because of opposition from not Republicans. They wouldn't be the problem. They're a smaller minority in that committee. But opposition from Democrats. 7 blue dog Democrats who want to hold that process up to extract some important concessions. We'll talk about some of those. On the Senate side, we have the Senate Health Committee, chaired by Senator Kennedy, whose absence from actual involvement in the Senate is sorely felt in this process. Senator Dodd is trying to fill in for him in Senator Kennedy's absence. But that committee did succeed in getting its bill voted out by its committee, which is a great step forward, and it's a good bill. The Senate Finance Committee, chaired by Senator Max Baucus, is holding things up. Senator Baucus is trying very hard for the kind of bipartisanship that I think was Robert Reich was talking about in that video. That he is trying to get Republican votes, and what is it that he's going to have to give up in order to get any Republican votes, and how many will he get? Would it even be a meaningful number of Republicans, or would it simply be some window dressing? What is it that they are advocating? There are 8 points that I'd like you to keep in mind from these bills and from President Obama's position that define the issues and the policies that they're advocating with respect to coverage and affordability. I'm not going to get into the issues of quality and prevention. Those are very important, but that's for another evening. Number 1 is the principle which Robert Reich articulated, which if you have health insurance that you like, you get to keep it. You don't need to make any change at all. But if you don't have health insurance, or if you have coverage that you don't like, you're going to have options. You're going to have options to choose a different kind of plan that will be affordable and comprehensive to meet your needs. That's number 1. So that's the overall global message that they all are trying to communicate with the policies and the principles in their reform bills. Second, all health plans will be prohibited from excluding anybody because of a pre-existing health condition, and they'll also be prohibited from charging more because of a health condition. They will be able to charge somewhat more based on age and geography, but not because of a person's health.